This is video 2 for nursing 210. Okay, first we're going to inspect the lungs and the thorax. We're looking at the anterior and posterior thorax, looking at the shape, color, how it moves with respiration, looking at the symmetry of the thorax, and looking at the anterior and posterior diameter. Then we're inspecting to see if there's any bulges, masses, or lesions. Is there any tenderness? Okay, then we are going to percuss. If you could turn around and face the other direction. Or we're palpating the thoracic expansion. If you could breathe in and now breathe out. And we're checking to make sure that the lungs are inhaling and exhaling bilaterally. Then we are going to percuss over the posterior lung sound. Listening for resonance. I'm going to lift up your shirt. You can take a deep breath in. Okay, breathe out. Breathe out. Relax. Go ahead and take a deep breath in for me again. Okay. Lift this up a little bit. Take a deep breath in. Take a deep breath out. Then we're going to measure it. It's about 5 centimeters. Normal is 3 to 6 centimeters. So that's within normal measurement. Now I'm going to listen to your lung sound. Take a deep breath. Exhale. Okay, you turn around and face forward towards me. And we also lung sound anteriorly. We should hear broncho-vesicular sounds there without any adventitious breath sounds. Now we're going to be inspecting The cardiac system, first we're inspecting, seeing if there's any heaves, lifts, or thrush, which there should not be. Then we are palpating, checking to see if we can feel the pulsation, to locate the PMI, and if there's any murmurs. Then we're going to auscultate, starting at the second intercostal space, right of the sternal border. We're listening to the aortic heart sound. This is where S2 should be heard louder than S1. Then we move across the second intercostal space, left to the sternal border, listening to the pulmonic heart sound. Moving down to the third intercostal space, left of the sternal border, this is Erb's point, where S1 and S2 should be heard equally. Then we're moving down to the fourth, fifth intercostal space, left of the sternal border, mid-clavicular line. This is the tricuspid area. Where S1 should be heard louder than S2. Then we're moving down further, listening to the mitral area where the apical pulse is. This is also where the PMI is located. After auscultating, then we're going to palpate. We're palpating temporal arteries, then the brachial arteries, and then the radial and ulnar arteries. I'm going to ask you to lay down, and then I'm going to assess her pulses at her lower extremities. Assessing the popliteal pulses. Dorsalis pedis pulses. And posterior tibial pulses. Okay, I'm going to scan the room, and then we're going to assess the abdominal area. Now we're assessing the abdominal area. You lift up your shirt. We're inspecting the abdominal area for striae, vascular patterns, looking to see if the pulsations are visible, looking to see if there's any observable bulges, masses, or hernias. Also looking at the umbilicus for contour, shape, symmetry, making sure there's no colon signs. Then I'm going to auscultate, starting with listening to the vowel sounds. listening to the vowel sounds in all four quadrants, and we're going to listen to see if there's any friction over the organs. Now we're also going to be listening to the arteries, listening to iliac arteries, listening to see if they're listening for any bruits. And the renals. And then down below will be the femoral arteries. After listening to the vowel sounds and the arteries, then we're going to percuss the abdomen. Then we're going to palpate the liver. Percuss the liver. And then percuss the spleen. And at this time, noting that the spleen is not enlarged, so that's not palpable. Then we're going to measure the liver. You can pull up a little bit. I'm going to push down. Make a little marking. I'm going from top to bottom. And we're going to measure. This is measuring at about 9. Normal is between 6 and 12. Then we're going to palpate the liver. If you can push up. Okay, relax. Now we're going to palpate the kidney. And that's the end of the exam.